My patient was struggling to drive. He had lost focus, coordination, and comfort with drive. This is part of a common sense Lyme disease series where I discuss cases I've seen in my practice and that have come up in my practice. But this man had been driving for 15 years. It was routine driving and a commute, but he lost focus. The drive felt unfamiliar to him. He had brain fog, fatigue, pain, and numbness, and each drive got harder. Now, he was diagnosed with Lyme disease based on a broad range of issues, including cognitive decline, fatigue, nerve pain, and sensory overload. In this case, in sensory overload, I often see patients who have an overactive immune state, an overactive kind of fight or flight reflex. The neurotransmitters push the sensitivity to light, sometimes to sound, heat and cold, but also it interferes with processing. There's too much going on, and so that paying attention to who's coming and who's going and where you are in the car and where you're sitting in the car and vibrations all become overwhelming. And they're a subset of what's going on with what's called brain fog. So in this case, he had bright lights, motion issues, noise was too much, and he couldn't filter all of it out, which led to a panic type feeling. So he had tests, he had MRIs and tried different therapies, and he was still sick, and he wasn't able to drive. He could drive a local road for a few blocks, but that was it. When he was finally diagnosed with Lyme disease, he happened to have a positive test, which you don't always get a positive test. You have to use clinical judgment. In this case, it was easier because the diagnosis included a positive test. Once he got started on treatment, gradually he was able to improve health-wise, but what was especially important was his ability to be able to commute to work. He could drive without fear again. So what should you watch out for when Lyme doesn't show up as a tick bite or rash is that if someone has a trouble driving and they also happen to have brain fog, fatigue, sensory sensitivity, then you would be best to at least include Lyme disease in the evaluation. And I have had that on a number of occasions, and it's very satisfying when you get the ability to drive back. Thank you for joining me for this Common Sense Lyme series. Have a good day.